What jurisdiction applies to telehealth medical malpractice claims? Imagine you're talking to a doctor through your computer and suddenly face a medical issue. Who's responsible if something goes wrong? That's where jurisdiction comes into play. When it comes to telehealth and malpractice claims, the key factor is where the patient is at the time of the appointment. It's not about where the doctor is located. If you are in one state and your doctor is in another, the laws of your state usually govern any malpractice case. This is because each state has its own rules about medical malpractice, standards of care, and licensing. So, if a doctor provides telemedicine services to someone in a different state, they need to follow the laws of the patient's state. That means the doctor must be licensed in that state to legally treat you. If not, they could face fines or disciplinary actions. Malpractice standards can vary too. Some states use a locality rule, meaning the doctor is held to the standard of care typical in the patient's area. Other states follow a national standard, which sets a broader benchmark for medical practice. This difference can impact how a malpractice case is judged. Things get more complicated because telehealth involves multiple factors. It's not just where the patient lives, but also where the provider is based and even where the technology servers are located. All these elements can influence which state's laws apply. This can make it tricky to determine liability and insurance coverage. For telehealth platforms, remote patient monitoring, and mental health teletherapy, understanding jurisdiction is vital. Providers need to verify where the patient is during each session. They also need to ensure they are licensed in that state and follow its laws on consent, privacy, and prescriptions. When setting up telehealth appointments, providers should always confirm the patient's location at the start. They should verify that their license covers that state and review specific laws about telehealth practices there. Also, check that malpractice insurance covers services across those states. In summary, the patient's location during the telehealth visit usually determines which state's laws apply. Providers must be licensed in that state and follow its regulations to avoid legal issues. This way, they can deliver safe, compliant care no matter where the patient is.